Thank you everyone for joining us. I'm so happy to be here with Dr. Maryam Zeineddin, who has become a friend of mine over the past year. Thanks so much for being here for this episode of Sacred Space.
I am honored that you asked me, and I'm very excited. So thank you for having me.
I am too, because we have an event that we are going to be part of together, an event that you are spearheading. And we'll get into that a little bit. But before we get into Beyond Wellness, which is going to be taking place in April here in Metro Vancouver, I want you to tell our listeners here a little bit about yourself and your background, because I find it quite fascinating.
Oh, well, thank you. Well, yes. So I am a Canadian Iranian soul, I was going to say. I'm trying to disidentify as much as possible with all my
Mm.
identities, but I do carry a lot of hats, including being a local family doctor on the North Shore for the last 20 years and a business owner. So I co-own a clinic on the North Shore with actually one of my amazing classmates we went to school at UBC. And we cumulatively, with all the staff and doctors, we carry over 15,000 patients in our clinic. And so you can imagine I've been a family doctor now for this many years, and I've kind of gone through the pains of lack of access, resources for our patients, band-aiding our patients for so long that, at some point, I was actually about to leave family medicine. I couldn't,
Mm.
I couldn't, I didn't feel like I was doing the job I was meant to do. And it's quite concerning when you go to work and you're like, okay, today I'm just going to feel like I'm going to do the best I can. And then you feel like you failed your patients because you don't have enough time with them. You can't give them the resources you want. The way the healthcare system is even now set up is to band-aid. And I felt it even myself. We doctors, we're also patients. And I have two daughters, and they're wonderful human beings. They're older now, but when I had them in between my two girls, I had postpartum depression, and I had a wonderful family doctor, but it was hard for me to even. I felt guilty even going to see her because I would be like, I don't want to burden her,
Mm.
so overworked. I don't want to burden her. And I was like, well, no, actually, you know what? I am a patient and I need to address my own health and well-being. And it was, it was at a point, it was like a pivotal point where either I leave family medicine or take that pain that I feel for my patients and for all the other family doctors who were struggling, um, and do something about it. And so I did one of two things. I created ZiliCare, which is a preventative health platform. It's kind of like my baby, like your podcast. Um, and it was like a local success story. We would bring experts and we would bring a community together. And it was local. It was from, Vancouver, and it was mostly for women because I'm very for gender equity and women's health. That's probably one of my biggest values. And I come from
Mhm.
this Iranian, background where women have been suppressed for a very, very long time. So multi-generationally. And I come from three daughters. So you can just imagine.
A lot of
So
feminine energy.
very much so. And yes, you'll meet my mom one day, you'll know. And so, ZiliCare was created more as sort of to change things from the outside and give ownership to the patients to really know how to care for themselves. And then I went into leadership, and we changed a completely new payment model that we've had now for the last 3 years, so we can have a little bit more time with our patients. But change is slow, and I think we need all hands on deck from every corner. And I love the fact that you've created this podcast so that you can really, touch people's hearts and souls and improve their health and well-being. Because health and well-being, to me, it's not just how you feel as an individual. For me,
Hmm.
it's very collective and very much about connection and community.
Absolutely. And I think like, I think back to like, oh, becoming a journalist, like, why did I become a journalist? And it's like really because I care about people and I'm humanitarian.
Yeah.
But there's a part, where maybe just like you in your career where I've been longing to do more, to have those conversations that go a little bit deeper. And really we can talk about affecting change at a community level and at a societal level. And, you have slowly been doing that. For many years. And now you have this event coming up called Beyond Wellness,
Mhm.
where hundreds of people are going to be gathering in a room to talk about the future of the way that we care for each other. And I think that what you're doing is so courageous because there's a lot of people that might not want to change. What is the goal of this event, and what are the changes that you want to see in the way that we care for each other in this society?
Yeah, I think the fact that we're calling it Beyond Wellness is a little bit of a hint to what society has kind of created this massive marketing for everybody to buy in on wellness products and marketing, and actually us females particularly, we are really more than 70% of the consumers of the wellness industry. And I keep looking at all these ads and these pushes into women being a certain way, looking a certain way, exercising a certain way, being a certain size. And it really stresses me, actually, because I have two daughters. And then I look at our own healthcare system and I say to myself, okay, so really, health and well-being, there's really not that much conversation around what health and well-being actually means. And we're really just, it's like almost like this checkbox of do your preventative, your health screening, do your mammogram, do your pap smear.
Hmm.
And then, it's very individualistic.
Well, I think it becomes prescriptive, right? And it's like,
Very.
okay, let's treat, but what about having a conversation about how my mental health is? Because I think that's the piece that's missing. It's like, we treat the physical, but we're not connecting the mind, the soul, and the body together. And, our bodies work in unison with all three.
Yeah, and this is kind of, this is the reason why we have the Gabor Mates of the world speaking on the 21st on Beyond Wellness. He's been harping at this for, over 25 years. I remember even when I was a student, so actually it's kind of like a mentee-mentor relationship that him and I have. And I knew him even before he was a rock star.
I
And,
can't wait to meet him, by the way. I'm a big fan of his work.
yeah, no, you're gonna love him, and he's just he's a wonderful soul and a wonderful human being, and he is a humanitarian. And I think one of the things he was trying to say to me was that why is it that you're learning in medical school, you know, um, when somebody comes with a symptom, let's say somebody says, "Oh, I just have this headache," and then the first thing you think about is, okay, let's make sure we rule out all the physical things. So we go through our kind of algorithm that we've learned. Uh,
Hmm.
we may send you to a neurologist, and there's all these ologists that we have to send you, and none of them really speak to one another. That's the sad part. You've got a skin condition, we send you to the dermatologist, and as a family doctor, I feel like the only specialty, and I call family medicine a specialty now because we are specialists in primary care, um, is really the only specialty where we've been taught to ask about social determinants of health. We
Mm.
actually have been taught to ask, So what's happening in your family? What's your financial situation? Where do you live? What kind of circumstances do you live? And weirdly enough, of all these things, a social determinant of health, it's your economic status, poverty, um, being female is a
Mhm.
social determinant of health, actually. So aside from all this, what we do in the conventional world of medicine is that we really focus on your physical symptoms. We reassure you about your physical symptoms. Then we go to your mental health and we say, well, now that everything else looks normal to you, let's talk about mental health and well-being. And I feel like it's such a disservice to our patients in some ways. I feel like we really need to make sure we all understand that it is one system. Your mental, physical, emotional, spiritual health and well-being is actually one interconnected system. They're not just connected, they're actually one system. We used to say they're connected with one another. Now we're saying, no, 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 no. It's all one.
Mhm.
And I think we still have a long way to go in the conventional world of medicine. And I think I'm very excited because this is the first time we have physicians sitting with energy healers, sitting with entrepreneurs, sitting um, with other indigenous healers and researchers, and we're all speaking the same language.
Mhm. Yeah, I was going to ask you about, have you run in, I'm sure you probably have, but hesitancy from your fellow colleagues, maybe because, in med school, you're taught a certain way, and maybe, what you're speaking about right now was not in the textbooks.
No, not at all. In fact, it's coming more and more, but it's when Gabor Mate wrote the book When the Body Says No, and he wrote this, over 25 years ago. And I remember, and there's ample of evidence in his book. And there is evidence that
All around us, really.
it's all around us. I remember my colleagues saying, I don't know. It seems so they weren't buying it yet, and it's because they hadn't heard it. It's like, you need to almost hear it a few times from different angles, and you need to start seeing what it is that for instance, let's talk about cancer. How we always put a lot of money and emphasis in cancer, but is and we say, well, there's genetic reasons why people can get cancer, and there's the genes you carry. We always ask about your family history, but there is also epigenetics involved, meaning that there is a way to not necessarily turn on your bad genes, and there's a way to turn on your good genes. So just because your father or your grandfather had, let's say, diabetes, doesn't mean you're going to get diabetes. Just because you have the Alzheimer's gene doesn't necessarily mean you're going to get Alzheimer's. And, with mental health as well, unfortunately, now is rampant ADD. Everybody has ADD. Everybody has attention deficit disorder, and in their opinion, because we're so overstimulated. And we're all about really, multitasking, and we're working. There's no break for our mind even to take a break.
It feels like in our modern world, especially in the last 20 to 30 years, we have forgotten what it means to be human.
Yeah.
And very few of us actually stop just to pause
Yeah.
and to ask yourself, how am I feeling?
No, and I think it's also because there is this tendency of I can't get bored. Like I need that sort of constant. Every time you pick up your phone, actually, what happens is you get a little dopamine kick. It's the same thing as you going to Vegas and pulling that slot machine. And people don't realize that. I always say to my patients, it's not how long you're on your phone, it's how often you pick it up. So
Hmm.
really pay attention to how often you actually go for your phone for no reason. So I tend to put away my phone completely. So there's no way during work I can actually go on it. I do not bring my phone to the washroom. Like there's certain sacred spaces that I'm like, no, no, no. During meals, so just to give your brain a break. And also, while I'm standing in a lineup to get my coffee, why am I going on my phone?
Hmm. Yeah, it makes you think about the world that we're living in right now, and like, what is the ideal state that we should be living in. And I think back to a simpler time when people maybe lived in smaller communities, or even in some countries that maybe aren't as advanced, they are still living that way, and they have that community connection. It's the village that raises the child. It's not just the one family. And I think that we have kind of forgotten that we are all interconnected, and that when we have that social connection, when we have that support system, it it's healthy for everyone involved. And I think that's kind of what we've lost. We're on our phones, we're all in our individual homes on our screens, but we're not face to face with each other anymore. Not as much as we used to be before, technology and phones have really kind of taken over.
Yeah, and we now are seeing rampant an epidemic of mental health concerns in our youth and older. And and mental health, really, we can't just say mental health, because when you have mental health concerns, if you have anxiety, depression, any other mental health concerns, your inflammatory markers are high. So it's an inflammatory process. And when your body has inflammation, it will turn on other things. So
Hmm.
and we're seeing way more of chronic illnesses, autoimmune diseases, things that we didn't see as much before. We're seeing more early cancers. We're seeing really not the typical things that we used to. Our science has come a very long way to get rid of a lot of the infectious illnesses that we used to die from. But the mental health component, and also to add the element of loneliness and this individualistic way of thinking of health and well-being, it doesn't serve us. And when now you see, when you talk about technology and social media does make us feel like we're connected. And yes, you can FaceTime someone that's in a different country. There are some elements that are actually pretty good about it, but it also has made us less connected, because there's less of a curiosity even around about who's around you. Before,
Hmm.
there was no phones and you couldn't check your email or you couldn't check your social media while you're standing in the lineup. You may have been kind of looking around, and you may have not talked to someone, but you may have actually even noticed what's around you.
Yeah,
Now
it's like
we don't
we've
have
lost that awareness.
we've lost the awareness of curiosity. And also, I think slowly but surely, it becomes easier and easier to compartmentalize things for us. Because right now, with the uncertainty in the world, the viciousness and the lack of world order that we're seeing, with our world leaders speaking the way they're speaking, and um, what happened, and the wars that are happening. And I'm Iranian, so you can just imagine how I'm feeling. Um, I may scroll and see news about the bombing and the death toll. And then the next, I'm looking at a puppy. And it's really bizarre how your brain is supposed to process all this and make sense of it all. So what does your brain do to protect you? It distances you from your
Or
human.
it puts you in fight or flight, and
Yeah, or
you're.
just that freeze, like where you're just like, you know what? It's not me. It's not in my neighborhood. I don't have to worry about it.
Hmm.
And at the same time, the opposite can happen too. I've had patients sit in their grief for such a long time, just grieving what's happening on the other side of the world, and feeling paralyzed by it, without
Yeah.
being able to be in the present moment. And this is kind of the thing, Sonia. I think, as much as I don't think meditation and mindfulness is going to solve all our problems, there's an element about being present that brings your humanity in place.
Absolutely. I think presence, being in the current moment, is so important right now. And I think you highlight a really important point, and it's that as humans, we're not meant to know every single thing that's happening in the world at every given moment.
No.
That is not what is healthy for our brains.
Yeah.
And so there has to be balance. And I think that maybe that's where we're trying to get to, is a better balance. How can we, still feel that we're informed, maybe still feel that we know what's happening in the world, but it's not affecting us to the point where it's maybe turning on those genetic markers.
Yeah.
And I think that's really what this event is about questioning the path that we've been on. And do we want to keep going down this way, or is there a better way? And I think those are some of the ideas that we're going to hear. And there's a lot of points you brought up, and I want to get back to epigenetics and, turning on your good genes. But what I also wanted to ask you specifically was, what do you see as the best case scenario? How do you see healthcare playing out maybe in 20 to 30 years? What is your vision or your dream?
My dream is honestly that the patient, meaning us, we have ownership of our own health. We carry our own information. Because right now it's really bizarre how your doctor actually is owning your information. And you have to be like struggling to get the imaging that you did and this and that. And it's all written in doctor language. So half the time you don't even know how to interpret it. Even now, if you can see your labs, you stress out because there's a red, on there. That's just one element, that you actually own your information. You own your ability to advocate for yourself, but in a team setting. So, there's in my dream is that you are at the center of your own health, and you're going to have advocates advocating for you, like your family doctor, but you also will have access to uh, allied healthcare providers who can really bring in that extra for you. Let's say right now, for instance, one of the biggest things we've been able to do is do social prescribing. And social prescribing is really outside of medicine in some ways. We're prescribing for people that do not have someone to take them. We have connectors now that we can prescribe a connector, a human being, a human connector, to come and take you to the park and take you to nature. I mean, that is called community health right there.
Mm.
And it's proactive health, it's preventative health. I don't want that individual who is lonely, who doesn't have a family member, who doesn't have a neighbor or a kind neighbor, to come and actually check on them. So for me, what I see is the patient's at the center. They know how to regulate their nervous system. They know how to take advantage of their beautiful community, and they know how to give back to their community. And they're looking with the lens of not how am I feeling only, and what have I been exercising and eating, and I've done my yoga. It's more, yes, I need to fill my mind, body, and soul in order to be there for my community.
Mm. Because we are all interconnected. I think that's also what you're touching on, is that web, that network that we are so missing right now with all the with, like you said, the epidemic of loneliness that we're seeing. And
Yeah.
I've wondered sometimes, why don't we have more community gathering spaces? Like, yes, we have parks, but maybe it needs to be more of a a meetup kind of situation where there are like these social circles where people can just go to. If you're lonely, go there. There are lots of other people that can have a chat with you. Or I don't know what it is exactly that I'm envisioning, but I'm like, surely there has to be a solution.
And
There
there
has to
are.
be.
And there's lots, I have to tell you, there are a lot of not-for-profits, and there's a lot of organizations that are doing just that. It's just that we need to come together. And I think coordinating things, even with our current healthcare system. Our healthcare system needs to, for instance, understand how important to have a team-based approach. And right now we're kind of have a team-based approach, but not really. You have the most responsible physician that was supposed to see you. We still don't have everybody being attached to a family doctor or a nurse practitioner. We still have at least 500,000 individuals not have a family doctor. And then on top of that, the family doctors, they don't necessarily need to be utilized the way they're being utilized. If I had a social worker working with me at any given time, if I had a mental health worker working with me at any given time, I would then be able to check in on my patients and then be able to sort of get them to see my colleagues, my team, and then come back. And I think we're trying to navigate this, but there are a lot of barriers even in the system in terms of who gets what resource gets whom. We have a lot of rural communities that don't have access to anything. I mean, let alone just pure imaging or ambulance care. So for me to, in an urban setting say, well, I would like this team and I would like everybody to be there for me. Right now, it's all about, okay, what are the needs of the community in the rural? Who are they needing? Every community is different. And I have to tell you, even as much as I say, well, we can't think that much individualistically, it is still a very personalized way to heal and feel like you're healthy and your well-being is taken care of. Because again, healing is not a destination. And and I have had to remember this many, many times. A lot of times I take this amazing 1-year course I took with Gabor Mate, and I was like, okay, I'm healed. This is amazing. Like, I am just feeling great. You bring it on.
I'm done.
I'm done. And then he just looks at me and he's like, it's not finite, it's infinite. Health and that you're healing. That's why healing is not a destination. It's a journey. And I think if you look at your health and well-being as a journey, you'll have more grace for yourself. I think people are like, yes, right now, like I'm good just at this moment. I just want to do a full MRI scan and just make sure that I'm well right now. I say, yeah, you could do that. But in 3 months' time, that scan may mean nothing. So I think there's beauty in technology, there's beauty in imaging, there's beauty in team-based care, there's beauty in understanding yourself, being aware of how your mind and body and soul is speaking to you. The problem with this society right now, the way technology and the ampleness of information that's coming at us, it's disconnecting us from ourselves. And this is the way to reconnect to yourself in order for you to see what's going on in your community.
Yeah. And to come from that place of knowing and, fully being instead of living and ticking the boxes. I wanted to circle back to something you said earlier, because I think epigenetics is one of those, it's a hot topic. You hear about it a lot. And you talked about, not wanting to turn on those bad genes. So, people, I immediately was like, well, then how do I turn on the good genes?
Yeah.
How do I do that? Like, I know that there's no hard and fast, simple rule book to that, but what are the things we should be focusing on if we want to make sure that we're going to live healthy and that we're checking in with ourselves?
Yeah, so that is kind of what, unfortunately, we haven't been able to have as much. Is the biggest word I can tell you is safety, a sense of safety and a sense of belonging and a sense of being able to be our true selves. And when we are, feeling level of stress, it's good to have acute stress. There's no problem with that. If you're getting anxious right before a podcast, that's good stress. That is
like when the audio wasn't working.
Yeah, like that's good stress, because that's a way for you to kind of get into your space to be able to fix and problem solve, and then you're back. Or when you're crossing the street, or when you're running away from a thief, that's acute stress. Your body protects you from imminent danger. The problem is, what we're seeing right now is that our sympathetic nervous system, what is supposed to protect us acutely, is now chronically on. So we are in this constant state of fight, flight, or freeze mode. And that is what's going to turn on your inflammatory markers. And it's the inflammatory markers that will then turn on your bad genes. And so, what do you do when you're in this constant fight or flight or freeze? A lot of people just are trying to numb themselves. They're trying to just not be here because it's so painful to be here. So you doom scroll, you go shopping, and you're just online shopping for things you don't even need.
Filling that void.
Yes, there is a massive amount of addiction. And we're not just talking about addictions to substances. We're talking workaholism is a form of addiction.
Mm-hmm.
And there's many, many, many other things you can get addicted to. I don't know if you've seen, but a lot of people are now addicted to exercise. They exercise in the morning, they exercise in the afternoon, they exercise at 3 a.m. And it's like anything where you're coping, where you're utilizing to an excess, is a form of addiction. So you have to understand that is where we're going to bring those tools. We're going to actually bring some of the insights and some of the tools of where you can actually bring yourself back to the present moment. I'm teaching my residents now, even after seeing each patient, because, I don't think we even teach about energy and energy, the energetic field that you go into each room, everybody, and patients come at their most vulnerable state. So you can just imagine for us,
the space you're holding for them, right?
You're holding, and we have to be present. And if you really want to be a good physician or a practitioner, you need to be able to hold space for your patient to feel that you're holding space and you're present. Even if it's 2 minutes and you're fully present for them, they can feel your presence. They actually feel heard. And when patients feel heard, it's not even about what you do, what you say, and how you solve their problem. If they feel heard, that itself is a form of a space for healing for them.
Because they feel safer.
Yes. And this is where we all go back to, the 3 words for beyond wellness is really authenticity, belonging, and care. And, you cannot be authentic if you do not belong, and you cannot have care for yourself if you don't have the other 2, and because it's all interconnected. And right now, I feel it even in school, in the school system, there's really very little sense of safety because kids are now carrying their phones. They have Snapchat. They know exactly where their kid, if anybody wants to bully anyone, it doesn't end when you leave school. So it's very unfortunate because technology, as much as it saved us a lot of time right now, I have AI Scribe. It's amazing. It's writing my notes for me. It's not thinking for me, but it's writing my notes. So it's decreased my administrative burdens. So in that way, that technology is good. But in a lot of other ways, technology has not served us, really.
Yeah.
It has not served humanity.
I mean, I think in many ways we are going through a bit of a wake-up call just societally. I'm seeing so many more people having these conversations about, different states of consciousness or well-being or nervous system regulation. And I think it's a beautiful thing to have these conversations kind of woven into a traditional healthcare space as well. And to hear you even talk about energy, like it was music to my ears.
But nobody talks about energy in the conventional world.
I guess I do, but I'm like the woo-woo one. I'm like, everything is energy, right? But it is.
But it's interesting. I was speaking to somebody yesterday and they used the word woo-woo. And I said, well, actually, I don't use the word woo woo anymore because I don't believe it's woo woo.
Mm.
I believe it's science based,
Mm-hmm.
and it's evidence driven enough for me to have felt it, to know it, and to know that it works.
Mm-hmm.
There's something very beautiful about doing palliative care, and that's end of life care.
Yes.
And I used to hate it, actually, to be real honest, because I was too sensitive, and I'm a little bit of an empath, and I used to do obstetrics and palliative care. So I used to deliver
Oh,
babies
wow.
and
Beginning and end.
and I would be like, oh, and then my patients would say, I really would like you to be there, and do my whole end of life care. And I was like, are you sure? I could just refer you to like the palliative care doctor. No, I want you. And and I'd be so embarrassed. I couldn't say no. So I would do it reluctantly. I would do it, and I would, in the depth of my soul, feel the grief for every patient that I would lose, even though it was a beautiful exit of this
Mm-hmm.
world. And I used to joke with them, and I used to, say, oh, I just hope you die of kidney failure. Like, what? They're like, well, that is the most harmless way to die. It's
I'll have to
less
keep a
painful.
note of that.
It's the least painful. Like, we just don't want you to have heart failure. And then it's,
Mm.
yes. And every time I'd enter the hospice or their homes or the palliative care ward, um, my patients would say, oh, I just feel better when you walk in. And I'd be like, what are they talking about? I'm not doing anything. I feel like half the time I'm not doing anything. In fact, I'm just there to make sure they're not in pain. I mean, really, conventional world of medicine, that's all we do for end of life care. We just make sure that, they can leave this world with dignity and with as little pain as possible.
Mm-hmm.
That's all I thought my life was about. That's what it was. And the more I witnessed my patients going, dying and leaving their bodies, or watching the families, or watching the impact of the nurses that would come, and the nurses that were so kind, or the team members that were there, and they would hold my patients' hands. And every time I would see my own patient, and even the little cries or the lack of cries or the funny moments I had with them, I realized there's something very energetically spiritual around that time, as much as there is when a new baby gets born. It's very similar,
I
actually.
have goosebumps right now.
Yeah, and it's the most beautiful thing to recognize. And I realize that energy healers also do a lot of work with the deceased. And I have gone through indigenous healing practices with phenomenal indigenous healers where they honor the ancestors. And I think there's something so beautiful around not only honoring the land and where you live, but the ancestors that came before you, and they're there to
Absolutely.
protect you. And how this at all weaves into your health and well-being is, I think there's something about having grace for your imperfection, for yourself, for all the mistakes you make in life, which we do a lot. It all comes in with so much grace and so much humility, because I do believe that your ancestors are watching over you, and you are being given that intergenerational trauma,
Mm.
regardless if nothing's ever happened in your life and you're like, nah, I'm fine. I've never had small T, big T trauma, nothing. But I always say, if you're female, you've had intergenerational trauma.
You're still carrying it in a way, whether you're conscious of it or not. I'm totally with you on that one. It's there. But I wanted to touch on, you were saying, like, how does this connect to health and wellness? Well, I think you kind of said it yourself, that moment when you walked in the room to your palliative care patient, they said to you, I just feel better when you're here.
Yeah.
It's like your presence is like that warm, comforting hug, that safety net
Yeah.
that they need. And I think that's the same feeling you get when you think about your ancestors, or when you honor your ancestors, or, you say a prayer with them in mind.
Yeah.
And it's funny that you mentioned that, because as I've been getting this podcast ready, that's exactly who I've been thinking about, is my ancestors,
Oh, see.
because I know how much hardship they went through.
Mhm.
I am a daughter of immigrants, and my grandfather immigrated here to Canada in the 1920s or 30s. I didn't get to meet him. He passed away when my father was quite young. But I think of him often, my grandmother, my grandparents in India, their mother and fathers, who I never met, because I know in my heart they're with me
Yeah.
all the time. And I know they're proud, because they have paved a way for me to do things that they never could in their lifetime.
Yeah.
And
It gives you so much strength, it
it
gives you
does.
grace. It gives you, you can kind of carry that beautiful crown of yours and feel good about it, regardless of all the intricacies of and the ebbs and flows of what life brings us. And I think this is the thing I always say to my patients. They walk into my door and and they're definitely at their most vulnerable state, and they apologize if they cry. All of them. Every single human being that walks into my office and they cry, and they always say, I don't know why I always cry when I see you.
Because they feel safe
They
to
feel
cry
safe.
in your presence.
They feel safe. But, it's the shaming of the emotion, any negative emotion. And I think, even your emotional health, just to bring in from a spiritual component, now bringing the emotional component, is our society has not taught us it's okay to have emotions.
Or to feel your emotions.
Exactly.
And I think part of that is because, whatever you want to call it, we are living in a patriarchal society right now.
Yeah.
And I think that if we were to move to something more balanced, more family centered, more community centered, because matriarchy, I don't think, is the opposite of patriarchy. I think it's actually quite different. It's more of a centralized model where everyone is on the same playing field. But I think if we were to transition to a society that was more open to allowing ourselves to feel, we wouldn't be carrying that energy inside of us, or saying sorry for crying. Like, what is wrong with feeling your emotion?
Well, because I think society, what it does for us is that it wants us to put everything in a box, a good or a bad box, up or down, left or right. And I think what I try to remember is that an emotion is an emotion. It's a feeling. And, yes, we have positive emotions, we have negative emotions, but all of them can coexist. And I think, as an Iranian, for instance, I carry this very low grade grief all the time. I pretend I'm fine, I smile, but if I am still and if I put my hand on my heart aches for the people of Iran and the people everywhere where there is injustice.
Mm-hmm.
And um and then I feel guilty when I feel joy, because I'm like, oh, well, I should just sit in my grief because the world is really in a bad place. And then I have to remind myself, no, you can have multiple emotions coexist. You have to honor your humanity. And when you honor your humanity, you can hold space for your joy, for your hope, for your grief, for your sadness. And one thing I learned in the Compassion Inquiry course that Gabor Mate spearheaded with another actually amazing practitioner, Sataram, um, they talk about an emotion. If you sit in your emotion without a narrative, so no narrative, no
Mm-hmm.
storyline attached, and you just say, okay, and it's kind of somatic work that you have to be able to do, and usually it's hard to do it on your own at times. You have to learn to do it. It's an experience, and you have to be able to be comfortable enough with your emotion to sit in it, because sometimes it can, if you have enough um, comfort, you can let it get as big as it wants. So I say to
Hmm.
my patients that are grieving of any kind, of a transition, of a loved one, of the state of the world, I say, you can sit in your grief, be it the sadness, the fear, whatever the emotion is, and wherever it is in your body. Sadness generally sits in your heart, but it can sit in other places. Anger for me sits in my jaw a lot. And
Me too.
yeah, the jaw, my jaw always like, oh, I need to speak.
Uh,
I need to speak my truth. Responsibility sits on your shoulders, right? And shame sits usually in your abdomen, like around that belt in your abdomen. And shame is the most negative emotion, the absolute most judgment, basically. And that's
mhm.
what we do. When we bully, we judge. We are probably one of our biggest bullies ourselves because we judge ourselves and we don't have grace for ourselves. And so I always say to them, listen, sit, listen to this beautiful music for 3 minutes a day without the story attached. And if you try it, the emotion actually, if it doesn't have a story attached to it, it leaves you within 3 minutes. It just dissipates. And
Yeah.
actually, one of the reasons why people, when they've had a good cry, they're like, oh, I kind of feel better.
Yes, because you finally let
Yes.
go of that energy that you've been holding on to.
Yes. And so, and this is the thing. And I actually see an energy healer because I believe in energy healing. And she tends to find things that are stuck. And usually when they're stuck, it's usually stuck in places that I have physical pain, that I've had
Hmm.
chronic physical pain. Usually, a lot with women, it sits in your hips,
Mm.
it's in hip area or your shoulder area.
Hmm.
And it's just so interesting. I've gone to people that have chronic pain, they get it because they seek for healing modalities.
Yeah,
People that have had trauma, they seek healing modalities. But this conversation beyond wellness is for everyone. It cannot be for if you have chronic pain or if you have mental health concerns or if you have gone through addiction or if you're a healthcare provider. You can be anybody and you would benefit from it.
absolutely. And I know that it is going to be a limited space in the room. It is going to be a well-attended event. So many people are talking about it. We have so many incredible speakers.
Yes.
Yourself, Dr. Gabor Mate, but tell us about the other speakers and what they'll be sharing.
Yeah, so we talked about matriarchy, and our Indigenous health leader and researcher, Dr. Brittany Bingham, is our opening speaker, and she's going to be talking about matriarchy and how interconnected we are, and how to honor where we are and the land that we're in, and how to honor the Indigenous ways of health and healing, and how we've really suppressed that for so long. And
Mm.
reconciliation has a long way to go when it comes to that. So I can't wait for her. And then we have these health champions that you're going to be sitting and interviewing, who are all very dear to me, actually. I know them all personally. One of them is an entrepreneur, and really, her name is Sonia Foley, one of the co-founders of a company called Matern, who really are really honoring women going through any form of transition in the corporate world. And it's just opening that conversation around
Mhm.
what does it mean to be working while you go through menopause or postpartum or any other transition. And I think they're opening not only the conversations and tools and insights, they're changing culture.
Absolutely.
And then we have Dr. Renee Fernandez, who is also a fellow family doctor and health leader, and a phenomenal health leader, actually, who negotiated with me and three other amazing physicians with a ample of help from everybody around us. We were just a negotiator sitting. And we negotiated a brand new payment model for family doctors in British Columbia. And that was like a massive policy change making for Canada, actually.
Yes.
So, this is not
Good,
just,
good, good work. Thank you.
yeah, it was amazing. And she she's still continuing to advocate for women's health. I mean, she'll tell a funny story, and I think I've told this before, where we were trying to advocate for women's health in our negotiations, and there was three of us, so three female physicians, and we decided we're going to use the word vagina 37 times in 1 hour. And we got
Well,
what we wanted.
did you feel the discomfort in the room?
So they were just like, yeah, whatever you want, just whatever. And I was like, yeah, well, that needs to be paid more because we've never gotten paid for this. And, women's health has really been discouraged because every time you would see a woman, you'd actually kind of lose money.
Mm.
So, and women only would get examined if they were having their pap smears. And I was like, well, you're only supposed to have your pap smear every 3 years. So what about the other things? And
Yeah.
women's health to a lot of the male decision makers is only vagina. So
Yeah,
I was
it's
like,
like, what
okay,
do they
we'll give
call it?
them vagina.
Bikini healthcare. I've heard
But it
that
worked.
concept.
You know what?
Yeah.
It worked. I mean, it can still get better. We got what we got, but we can always, that's kind of a starting point. That's Renee Fernandez for you. And she's a badass leader. And then we have this amazing Melissa Lem, who is really spearheaded nature prescribing and social prescribing. And she was the past president of the Physicians for the Environment. So really, we're talking outside of just clinical care. We're talking how does the climate and the nature around us impact our health and well-being? What does it look like to actually create a national social prescribing formula for everyone? I mean,
Mm.
this woman is also phenomenal. And then one of my favorites is Dr. Mark Sherman. He's very quiet, doesn't have much social media. He's like so under the radar. But he spearheaded meditation for physicians, meditation and mindfulness for physicians. And he holds these retreats in Hollyhock. And I went to Guatemala with him last
Oh,
year.
wow.
And he's going to be a wonderful soul to just experience, as much as our energy healer that's going to hold space for the entire room for after that.
Who I had an incredible session with.
Yeah. So
Wow.
I'm going to tell
Claudia.
you. Yeah. So she's an embodied energy healer and intuitive. And I think it's not what she says. It's not how she guides you. It's just her presence that people are going to feel. And actually, it's so funny. I've really wanted her to meet Gabor Mate because I wanted him to go and do a session with her.
Yeah.
So perfect.
That would be interesting. I'd love to be a fly on that wall, even though it's
I know
a private, confidential thing.
I know, but you know what? It's beautiful to bring these health champions like yourself. I mean, we didn't just pick you to be our MC just because you're beautiful. You embody what we're talking about.
Mm.
I have heard you speak in your Wellness Wednesdays with Global and all the work that you've done outside of your career to personally grow. And I really want to thank you because you have a way to just bring all these individuals together and hold space for an intimate evening. It is still fairly intimate. There's 400 people going to be in the room, but it's still fairly intimate because the room is quite we're all very close to one another.
All right. Well, I haven't seen the space yet, so I'm looking forward to it. And thank you so much for the kind words. You mentioned embodiment, and for the past couple of years, that has been my focus.
Yeah.
It's not about telling other people what to do.
No.
It's about walking the walk, be the change.
Yeah.
Be more aware, be more mindful. And it doesn't have to be this long list of to-dos like, oh, okay, now I got to meditate. Now I got to do this. It's a state of being.
Yeah. Yeah. And this is the thing. I think, ZiliCare started as a care formula for individuals, and the care formula is C, calm the mind, A, activate the body, R, reinforce the body, and then E, engage the soul. And that's been always a prescription of self-care that we've given out to patients. And I hope that this is going to disseminate into the school system, the any institution. But at the end of the day, it's very prescriptive, and ultimately it needs to be personalized, and we need to be able to personalize it so that we're well enough to care for our collective health. And I
Mm.
think now with the state of the world that we're in, we need to kind of connect and come together in communities in order to hold space for one another. And so I hope that we can have partners and sponsors that we have been able to accumulate that will support this kind of work, because it's all not for profit. And so the more we can bring the community together in person, not just virtually, in person, the better. And we've had people reach out from all over the country going, is this going to be streamed?
Mhm.
It's not going to be streamed, but we are going to put it out for free after the event. And
That's amazing.
we've gotten the permission from all the speakers, and so that people can actually watch it as well. But, I would obviously love for this to continue and this momentum to continue so that we can bring more community centered conversations and gatherings, because it is a gathering.
It
It's
is.
a movement, it's a movement to really challenge the essence and understanding of the heart and soul of our health and well-being.
Yeah. And I truly believe that the only way that our society, our communities improve is when we all participate.
Yeah.
And when if we want to see that change in the world, what is the change we want? Well, first we got to define it, and then we got to build it.
Exactly. And I think this is the thing. I think when you hold space for everyone and say, okay, can we challenge our own understanding of health and well-being? We challenge it, then we make a commitment. And this is kind of, imagine 400 people in the room. They all come from different walks of life, different age groups, quite a diverse group. Although the tickets are quite expensive, so there is a disadvantage for anybody with any socioeconomic challenges. We have been able to give out a lot of angel tickets as well. But regardless of those 400 individuals that may be in leadership roles, maybe in academia, maybe in various systems, they can also create change. So
Mhm.
this nice, beautiful ripple effect, little. So
Well, it has honestly, it's been an honor to not only speak to you today, but to get to know you over the past year or more than that. And I'm really so proud of what you're doing and what you're creating and the way that you're bringing people together, because it feels very collaborative and it feels like a warm hug.
yes, that's supposed to be, and it's supposed to be instilling some hope, because there's so much despair and so much discouragement around the beauty of this world. Unfortunately, all we're seeing is, um, things that we don't want to see.
Hmm.
And I do believe, again, and I always say this, there are way more good people in this world than bad people in this world.
Absolutely.
And there's a lot of us that want change. And in order for us to create change in any sector, we need to be well, and we need to understand what that well being means to us individually, collectively, and as a society. So I hope this will be the beginning of something bigger.
It will be. And I can't wait to see what this event creates down the line. I think that there will be more events like this. Maybe this is just the first of the first annual. Who knows what
Exactly.
what's being created? But yeah, I want to thank you, and I'm looking forward to it. And I'm so happy to hear that there will be that free version that people can access. I'll find a way to add it into the link. Add a link below once it is available, so that if people want to
Yeah.
further this conversation, that they can do so and actually hear from the speakers directly.
Absolutely. Thank you so
All
much,
right.
Sana.
Thank you
Thank
so much.
you.
Have a wonderful day.
Thanks. Bye.
Bye.